Hello and welcome to my video presentation for CNT 898, which also means that this is my last video presentation as I near completion of my master's degree. The purpose of this video is for me to select one of the 7 areas of my portfolio, discuss the artifacts I have selected, the process I went through to build those artifacts, and to present how completing these artifacts was relevant to my professional growth. My name is Rebecca Handley, and I was born and raised in beautiful San Diego, California. After high school, I attended Grossmont College and I got my associate's degree in respiratory therapy way back in 1990. 11 years later, I enrolled at the University of Kansas and I got my bachelor's degree also in respiratory therapy. It was at this time that I came back to Grossmont College, not as a student, but as a teacher. I've been teaching for the respiratory therapy program at Grossmont College for 14 wonderful years. Respiratory therapy is an allied health profession and is part of the Nursing and Allied Health Division at Grossmont College. I am also the Director of Clinical Education, where I am responsible for every aspect of my students' clinical experience at our area hospitals. Yet each day, I love coming into the classroom and I love seeing my students' faces as they learn how to care for others with cardiopulmonary disease. I love taking advantage of teaching moments, and nothing is more exciting than seeing that aha moment in my students' faces. And it's my students have inspired me to pursue my master's degree. When I read the requirements for this assignment and reread each of the standards and artifacts, I kept coming back to professionalism. What is professionalism? The best definition I found for this word is the skill, good judgment, and polite behavior that is expected as a person who is trained to do a job well. I believe that professionalism standard is where I can show the greatest amount of growth in my professional practice. And when I think about how I have grown professionally during this program, I think about the knowledge I have gained and how that had a direct impact on my skills as a teacher, which in turn has influenced my behavior both inside and outside of the classroom. For CAEP Standard 1.7, I needed to show evidence how I effectively applied the professional knowledge and skill to pre-K and 12th grade teaching in my e-portfolio. I felt that the best example for this standard was my final project in CNT 740 and my Q&A project in CNT 745. Both of these artifacts highlight the skills and knowledge I have gained and how that translates to my professionalism. The final project from CNT 740 is an excellent example of how I was able to create and implement specific reading strategies for a student who is struggling in reading. The purpose of this project was to tie together the key components learned in CNT 740. After choosing the award-winning book, One Crazy Summer, I then created an instructional plan for my hypothetical adolescent student, where I was able to incorporate a theoretical framework and model that included lesson plans on vocabulary, fluency, comprehension, and writing. This project also includes student assessment and further related readings. This assignment helped me to build the necessary knowledge needed to expand my own ability as a teacher. It is in this project that you can easily see in my portfolio my own cultural responsiveness through my book selection and the details of my lesson plans. While completing this project, I, for the first time, understood the need to use culturally responsive material to which my students can relate. This project marked a significant growth in my recognition of each student's needs and application of best practices for those who need it the most. From this project, I've been able to take the skills and knowledge that I have gained and exhibit a deeper understanding of cultural responsiveness in my own classroom and apply new approaches in reading literacy as my behavior reflects true professionalism. I'll admit, there were times in this program that I hesitated to see the relevance of the content in this course and others and its appropriateness for college students. However, I have had a complete change of heart, and I can now easily see that there is no age limit to implementing best practices that utilizes the skills and knowledge that I have gained in order to mold my professional behavior. I have started reading aloud to my students. I spend time reading case studies to them. This allows my students to hear how to pronounce medical terminology and hear the use of infrequently used words in medical context. They can build their critical thinking skills as they are able to make inferences regarding the patient's course of care and pathophysiology. I have my students completing graphic organizers and particular Venn diagrams, and I've seen an immediate improvement in comprehension. I have also incorporated the use of journal writing, where my students have to summarize key components of their text. I have provided for them examples of the GIST strategy, which is an effective and specific strategy that I included in my final project that builds summarization and comprehension skills. Therefore, this assignment also has given me a solid foundation in vocabulary, fluency, comprehension, and writing strategies as I incorporate new pedagogical approaches with my respiratory therapy curriculum in order to improve the reading literacy of my students as they become respiratory therapists, thus having a direct effect on my professional behavior. The Q&A project for C&T 745 is one of which I am most proud. The purpose of this project was to create a video based on research and a guiding question related to my professional practice. I wanted to know more about the English language learner in community college. This artifact identifies the obstacles faced by the English language learner in community colleges and shows how these obstacles can be removed or lessened, along with a detailed focus on providing bridges instead of barriers to ESL nursing students. As I completed the research, it was astonishing to find that a disproportionate number of ESL students do not enroll in community college despite their own desire to attend college, the open enrollment of community college, and the lower cost when compared to universities. California community colleges have had a long history of providing excellent education at a very affordable price. However, for those ESL students who do enroll, a very small percentage of these students move from ESL English courses onto college level courses, which makes degree completion nearly impossible. However, the research did show that when community colleges implemented a new pipeline with a shorter pathway to college level courses, as well as concurrent enrollment in both ESL courses and college level English, the ESL students were not only able to complete college level courses, but they also exhibited a higher GPA than those who did not follow the new pipeline. My research for this project also revealed that my own community college district has implemented a detailed student equity plan that recognizes the need to reduce the ESL pipeline and allow for concurrent enrollment in both ESL and college level courses. This has proved very successful at the Grossmont-Cuyamaca Community College District. Although my students cannot enroll in the respiratory therapy program until they complete college level English, my hope is that more and more ESL students are able to complete college level courses and that more ESL students apply for the respiratory therapy program. Also, now I have a better understanding of the struggles of ESL students and how to build bridges for my ESL students in my own classroom. Specific bridges would be avoiding word qualifiers such as best, most, and least in multiple choice questions, and these word qualifiers can be translated into an opposite meaning for the ESL learner. I can also provide PowerPoint lecture notes and handouts prior to class time. I can also encourage the use of handheld translators, and most importantly, I think, is to thwart American majority students and their attempts to argue for test points in class, as this can be seen as disrespectful in other countries and can make some ESL students feel uncomfortable. I believe that this project has helped me to develop a greater cultural competence for my classroom and students. This project has definitely given my view of professionalism a new look as I have adjusted my own behavior to reflect my conviction to create a welcoming classroom environment for all students. As for my own professional growth and goals, I look forward to embracing what I have learned on this journey and becoming an advocate for those who struggle to find success in the community college, especially the English language learner. In recent weeks, I've been reflecting on my future and my heart's desires. I've recently been pursuing new opportunities at the college, such as dean. I would really like to consider specific dean positions such as Dean of Student Equity and Inclusion, as well as Instructional Dean in Health Professions, where I can use what I've gained to have a greater impact on a greater population of students. I also think I see a doctoral program in my future. I've been looking at different EDD programs, and the first place where I'm going to consider to attend for an EDD is the University of Kansas. I started at KU for my bachelor's degree. I'm near completion of my master's degree. Why not go for the Jayhawk trifecta? It looks like it's time to take matters into my own hands. I would like to say a special thank you to all of my professors. Thank you for inspiring me. Thank you for helping me. And thank you for making me a better teacher. I will never forget you and this wonderful and challenging experience. My hope is that I can make it out to Kansas in May to participate in graduation, and I hope to meet all of you in person at that time as well. But until then, from San Diego, Rock Chalk Jayhawk, Handley out.